Hello again, and thank you for joining me for another episode of UNLEARN. Today we are going to go through the life and the techniques of Dr. George Goodheart. In summary, Dr. George J. Goodheart Jr. was a chiropractor out of Detroit, Michigan, who was the founder of Applied Kinesiology. Dr. Goodheart used muscle testing analysis that was actually based out of the work of Kendall and Kendall. Most muscle tests done in applied kinesiology do not evaluate the power a muscle can produce. Rather, they evaluate how the nervous system controls muscle function. Basically, it's using muscle testing as a functional neurology analysis. As brilliant as Dr. Goodheart was, many of his discoveries were actually made by serendipity and observation. The story of applied kinesiology starts in 1964 when a delivery driver / patient of his was actually dealing with a winged scapula, seen above. In presentations where there is a winged scapula, there usually is an issue with these muscles right here called the serratus anterior. Dr. Goodheart had noticed little nodules present in the origin and insertion points of these muscles, the serratus anterior, on this patient. He rubbed them vigorously, and then the patient's shoulder was able to work, and thus applied kinesiology was born. Dr. Goodheart continued to adopt several other diagnostic and therapeutic procedures relating to the intervertebral foramen, or what's called the IVF, and these included neurolymphatic points, or what are called Chapman's reflexes, developed by Frank Chapman in the early 1930s. Just like the winged scapular patient, these related to deep palpable nodules that were located within the fascia that had organ relationships within the body. Neurovascular reflex points, which are also called Bennett's reflexes, developed by Terence Bennett, who realized that there would be blood flow that would be distributed to different parts of the body based upon certain points that would be held on the skull. And we also have to pay tribute to this man, William Gardner Sutherland, who discovered cranial motion. He actually studied under the osteopath A.T. Still. He showed that there was a primary respiratory component to everything that we would be doing, and that the cranials as well as the sacrum and pelvis were in constant motion. Later on, influenced by Dr. Felix Mann, Dr. Goodheart started integrating meridian therapy of acupuncture into the practice of applied kinesiology as well. One other tool that we use in applied kinesiology is the concept of what's known as therapy localization, where a patient places their hand over the area of trauma and we would test a muscle, and we use this as a sensory enhancer mechanism to understand where the problem is in the patient. I also thought this was pretty cool. He actually had a whole article written about him in Time magazine back in 2001. The only reason he didn't make the cover is that Jesus made the cover. You can only win so much. He was also the first chiropractor for the Lake Placid 1980 Olympics. And now we have chiropractors in every single Olympics, all around the world. Applied kinesiology has transformed my practice, and I get to have the privilege of standing on the shoulders of people like Dr. George Goodheart and the techniques that he had developed and understood to benefit patients. And one of the greatest things I get to do every single day when I get out of bed is start using these techniques to help people gain a better quality of life. And it is such an honor and privilege to be able to do that. And I advise any one of you out there that if you're looking for somebody who will be able to help you, go on to icakusa.com and go to the Find the Doctor function, and you can find a well-qualified applied kinesiology practitioner in your area. This has been another episode of UNLEARN. Hope you learned something.